Hello. What's
Hello,
up, party
everybody.
people?
It's Wednesday night.
It is.
What's
It's
everybody
a big party
doing?
for us.
We are here to talk about our amazing nursing school planner. We are so excited to share details about the planner with you. And we have a number of surprises during this live broadcast. So
yeah, you guys are not even ready. If you thought that there were a lot of surprises last time, there's even more this time. Hi, everyone. Hi, Tara. Hi, Joanne. Michelle, how are you guys?
hello.
We have so much to share with you. So first of all, before we even get started, I want to just give you a little brief intro to like our big prize tonight. We've never done anything like this before. It is a first of its kind, and I'm hoping that you like it. At the end of the broadcast, you got to stay until the end, but we will be giving away a one-on-one hangout with me to go over some planner stuff, and we'll tell you all about it in a little bit, but it's going to be really fun.
It's huge. That is huge. So, and we have a lot of other surprises. So you're definitely not going to want to miss all of those during our broadcast.
Yes,
Hello,
absolutely.
Michelle.
And
Hello.
if you have been with us from the beginning, or if you are new to Level Up, we have got some surprises coming your way. No matter where you are, we're going to meet you where you are. We got something for everybody, and we're really excited about that. But also, if you are a YouTube member, I want you to know that at the end of this broadcast, there will be a members-only video. And in that members-only video, we're going to tell you how you can get a mild liner of your very own for free. I don't know if you guys are like planner people the way that I am, but mild liners are like the highlighter for planner people. And I mean, obviously you can use that on things that aren't a planner too, I guess. But you know what's so cool? Look at that. Level Up RN, it says on it. How neat is that? So if you are a YouTube member, you are going to want to look at the community tab. After this broadcast ends, we'll have a video telling you how to get it. And yeah, if you aren't a YouTube member, you still have plenty of time to go sign up if you want one for your very own too.
Totally. And hello to Fernando, who says that they are in maternal nursing right now, and their whole nursing program can be found in your guys' videos. So
heck yes,
getting you through that class for sure.
I am happy to do that.
Hey, I did pass my exit exams today. Your cards are a gem, Cathy. Right on. Congratulations. Awesome. I'm so happy. Oh, you guys have gotten me to the last semester. 20 days left.
20 days. Woo! Heck yes, that is incredible. And Michelle says that we're helping so much just reviewing the respiratory cards and videos. That's amazing.
Fantastic.
Complex
now,
care.
Do any of you all have our nursing school planner? How many
Even
of you
if
guys have it?
The last version, because this is our first academic year. So even if it's the last version. Do you?
I have both here. I have both. We've got our calendar year. So 2022 calendar year is on deep discount. So it's a really good deal. And then we have our academic year planner. Oh, good. Michelle has it.
Wow.
M21A has it. Tara has the last version. Yes.
Oh my gosh.
Candace saw the notification, had to hop on to say thank you. I passed my NCLEX on Friday.
Congratulations!
Yay! Use your flashcards all throughout nursing school and while preparing for the NCLEX.
I love that. Oh, we just got a new member.
Welcome.
Oh my gosh. Thank you so much.
Totally.
That's awesome. Well, we're super excited to tell you about the planner, why we made this, why we love it, what's different, why we think that it's, something that you need for nursing school, and of course, to bring you along for the ride as we give away some special surprises that I'm very excited about. Martha says,
Totally.
I'm not that great with planners. And I want to say real quick before we get started, I wasn't either for a very long time because I was using planners that were not made for the way my brain worked. And so we tried really, really hard to make a planner that you don't have to be consistent with if you don't want to. If you skip a week, that's cool. You've still got the room to plan your life there. And one that's specifically tailor-made for nursing students. So if you aren't that great with planners, maybe now's a good time to try out the last year's version, which still has several months left in it, but it's at a deep discount. You can grab one of those and see if it is for you.
Well, and as you guys probably know, managing your life, your schoolwork, your clinicals, your care plans, your papers, all the things you have to juggle in nursing school, it is a huge challenge, and you have to get organized, and you have to know when your things are due. You need to be able to pace yourself and know what's ahead, how you need to focus your time now and in the future. Time management and planning is an essential thing in nursing school. So really, this planner has been developed with those things in mind. So you want to share it, Meris?
Well, yes. So, if you guys have ever seen me talk about this before, it's the same story, and I'm sorry, but I failed out of nursing school the first time I went to nursing school. I went to school originally in 2010, and I was a very different person at a very different time in my life, but I was very unprepared for the demands of nursing school, and I failed out. And I went on to go back to school, try it again, and I graduated as valedictorian with a 3.97 GPA. Like, it 100%, I was the same person, right? I just learned how to manage my life and my time and my studying and all of that better. And honestly, my life was more complicated when I went back to school. I had 2 kids. I was actually pregnant with my second child when I started school. I had 2 jobs. Like, I had a lot going on, but because I learned time management skills, and this is the thing that I want you to know, it can be learned. You can practice, you can improve, you can master the art of time management. If you're sitting there thinking, I suck at time management, you do right now, but you can get better. Like, I promise you, I really promise you can. And one of the things that I didn't know about myself at the time was that I had ADHD. And as somebody with ADHD, I struggle a lot with time management and time blindness and understanding how much time something is actually going to take me. And so when I was in nursing school, I actually bought planners, like just from the local store, and I got custom stickers made on Etsy that basically to put over stuff that I didn't use to help me actually plan my life. And that got really expensive and really laborious and annoying. But when I was able to work on a nursing school planner, I was able to bake all of that stuff into it. And so this is the planner that I wish I had when I was in nursing school. This is the planner that I tried to make for myself with like jerry-rigged. I mean, this is why I'm an
with
ER.
stickers.
Because I'm out here like making my own planner with stickers. But yeah, this is the planner that I wanted, and this is the planner that I think will help you the most. So Michelle said, did Cathy or Meris design this, or team effort? It is always a team effort. Everything we do at Level Up is a team effort.
Totally.
We have different like passion projects and things like that. So this is my passion project, but without a doubt, the whole team, was like, we were like, what would you want your students to have? What would you want to have?
Totally. And you'll see stuff throughout this planner that we all had a hand in. Like, you'll notice our little cool chicken. So I don't know how many of you are familiar with our cool chicken, but this little guy kind of shows up whenever we have a fun or memorable way to remember key points that you need to know in nursing school. And so he's kind of like our little mascot. So with this planner, we decided to put him in a variety of situations depending on the month. So he's going back to school there.
The July one is one of my favorites.
Is it like
that?
I like
the July one where he's like looking up and you can see the fireworks reflecting in his glasses. I think is so cute.
And also for each of the months, there's like a little cool chicken hint here at the bottom. So taking some of our more popular hints and silly ways to remember key information, we've incorporated it here into the planner. So you'll get test taking tips as well as those cool chicken hints throughout the planner, which is awesome.
And little pep talks too. And that's the other thing is, like, you guys know us. We love to give you the most important information you need to know. We're here to give you the academic information and help you on your test. But we also want you to know that we are in your corner and that we have your back all the time. And nursing school can feel really, really isolating. And so we want, every time you get to a new month, we want to remind you that we're here for you. We've got your back and we're thinking of you. And you're not doing this alone. You always have us.
Totally. And a couple other things that I love about the planner is it's hardback. It is really, really sturdy. And it's got these reinforced corners here with the metal. So it's going to hold up in your backpack as opposed to kind of a soft-sided planner.
Yes. So if you are just joining us, yes, there is a bonus perk for members only. There are things coming for everybody though. So if you are not a YouTube member, I just asked Angelina if she can put the link to join in the comments. But you can join, you can become a member right now and get this perk. But this is going to be, members will be able to get a free mild liner highlighter with any purchase on our website. And there's going to be a video available on the community tab after this ends where you get all of the details on that. So if you're not already a member, you still can become one and you'll get one.
Totally.
So
like Meris said, we have surprises for everyone. So not just members.
So how much is the prior academic year planner? I believe it's $11 right now.
Yeah, and it's a calendar year, just to be clear. It's like a 2022 calendar and it's on sale for $11. So it is deeply discounted.
It's only going to get you through the end of January because it's calendar year. But this one, again, of course, academic. So this is going to be starting in August through the following August. So we are doing that. Somebody said, I prefer a yearly planner. 100%. We're going to keep chugging with that too. We're working on that one now. So yes, don't you worry. We still got your back there.
Totally. So we'll have calendar and academic year. And some people start school in, like I started school in January when I went to school, and other people start school like in August. So it's, you know, there's going to be a planner for everyone out there.
Yes, absolutely.
I've watched Cathy before. Great information. My first time watching Meris. Well, here's Meris. And Meris honestly is one of the smartest people I know, and she knows her information like nobody I know. And I'm grateful to have her helping the Level Up RN team and to be helping all those students out there learn the information. So
Cathy's gonna make me cry. So we're gonna just
I adore Meris. So
I adore you.
Yeah. So Olga, like Meris has videos out there like maternity nursing, fundamentals, the peds, like the principles of peds and growth and development.
And I'm recording some more videos right now.
Yeah, she's recording more videos. I'm recording more videos, so we're both actively recording videos. So you'll get a little bit of each of us. So
Angelina just put in the comments for YouTube. This is how to join the channel right here. Okay, so you're going to go to youtube.com/leveluprn/join. And for those of you watching on Facebook, I'm going to put that in the comments for you as well.
Okay, perfect. So just to share a few other things that I personally love about the planner. I love the little elastic here that you can pop over there to kind of hold your place and easily get to where you need to go on your current week. I love so much the references in the back of this planner. So you've got a tab. Make sure everybody can see. You got a tab for every month, and the last tab here is for our reference pages. And honestly, these reference pages are kind of worth the price of admission. It has everything that is hard to remember, like stuff you need to memorize for every single one of the nursing areas. So
So
there is
somebody
a,
had asked us about what's different in the planners, and this is one of the
oh,
things that's different. Yeah, I
yes,
just want to point out. All of the same stuff is there, like all of the same stuff that we had in the previous one. However, we also added some places where we may have been like, do we need that? And we're like, yeah, now we do.
throw
Like
it
we
in
made
there.
let's throw it in there. So now we have like nutrition and leadership,
Totally.
and psychiatric nursing also. So we have that. So yes, oh Brittany, I remember watching Maris on Instagram when she was still in school. That's so sweet.
Right. So for those of you who don't have our previous planner and are curious what's in the reference section, we have lab values, like all the important lab values, like the expected ranges.
And we have them, this is something that I didn't really learn until I was in clinical practice. We have them separated by like what the test is. So what's in a CBC, what's in a BMP, what's in an LFT. Like, so we have it here for you so that you can get familiar
Broken
with
up.
that and start to get that clinical knowledge together as well.
Totally. And we have a variety of things under health assessment, like all of the 12 cranial nerves and what they are called, what they control. We have the vital signs ranges for adults, for children, for infants. That's all in there.
This one is one of my favorites, the donning and doffing sequence for, like isolation gear, but we also have the types of precautions. So what type is it? What are the requirements? And what are some conditions that require it? Because that stuff is so important.
Totally important.
Yeah.
And then we've got injection site landmarks, needle angles for giving injections.
Yep.
What else do we have here? Placing your EKG electrodes.
Yeah, that's another thing that like a lot of schools don't teach you, and it's really important to know and to understand. So yes, love the references to help with remembering important information. Yes, me too. And I will tell you, the stuff that's in here is stuff that we as a nursing team felt we were constantly looking up. I cannot tell you how many times I was like, what's the AST value again? Like, I don't know. And then I'm trying to like Google it and I'm like, is this the right like thing? I don't know if it is. But here you can bank on the fact that everything that we have in here is referenced and from a reputable, peer-reviewed source, not just some random person on the internet telling you that this is the level.
Right. And we have like all sorts of pediatric nursing references as well. Gross motor development milestones, fine motor development milestones, the vaccine schedule. There's a bunch of great information for maternity nursing as well, right, Maris?
Oh, yeah. Oh, the maternity nursing. Oh, Martha, thank you for joining membership. That's so exciting. Maternity nursing is one of my favorites in general, but these, obviously you can't see, but I have this image up here on my wall because I love it so much, because I think it does the best job of explaining what the positions mean. This one has to do with fetal station. What does that mean, and where is it? Oh yeah, we've got the vaccine schedule in there. We have fetal heart rate patterns. What does it mean? We've got APGAR scoring. Everything that we think is the stuff that you're going to be looking up all of the time, it's in here. Nutrition, this is one of the ones that we added recently. So we've got overview of nutrients. We have different types of oral diets and what does it mean and what's in there. Look at that. Right. Vitamin deficiencies and what the
vitamin deficiencies, what that causes.
Oh yeah. We have a whole page on restraints, because this is stuff that you look up all of the time. So we have a whole thing on restraints. So Olga's asking how much does it cost? Right now it's $48.95 on the website. But I guess, it's probably about time for us to tell you about our first surprise, right?
All right. What's our first?
Okay, so our first surprise is going to be that now until midnight, if you're new to Level Up RN, if you're someone who has never used our flashcards, you may not know, but our flashcards are like our number one thing that people know us from. They use our flashcards and they pair it with our YouTube videos, and they're able to get this high yield, like the highly testable information. We don't give you any fluff. We don't give you any of the random stuff that textbooks give you. We say this is the most important stuff to know, and we made it for you as nursing students to help you in your studies. So if you
streamline and focus on what is most important, and then you have that to to read, to review through repetition, but they go along with our videos. So you can be listening to us explain different concepts, provide examples, and reinforce what you're seeing on those flashcards. So really the combination is pretty powerful.
Yes, and we know your time is precious and we don't want to be responsible for wasting it. So we give you straight to here's the stuff you got to know. And then we make it even better by making the stuff that we think is the most important of the most important. We make it bold and red. We give you those cool memory tricks. We give you key points. And if you are not someone who has used our flashcards before or you want to, we want to be able to help you out with that. So right now until midnight Pacific time, you can score an even better deal. You can get the planner for free. The planner will be yours for free if you grab the NCLEX pack or advanced nursing suite. So you need to use the code JUMPSTART, and I'm about to change the banner here for you. So code JUMPSTART, that is going to get you a free nursing school planner, this brand new one, this one right here, free for anybody who gets NCLEX pack or advanced nursing suite. If you want to try out our flashcards, this is the perfect time to do it.
Totally. And it's only good until midnight tonight, Pacific time.
Pacific time, 3 a.m. Eastern. Yes.
Totally. So share that with your friends, let them know, like it's only good till tonight though. So it's kind of a special deal that we kind of put out there for people who join our live and help to kind of celebrate this launch with us. So
absolutely. So Tara says, I know your planner has all of these areas to write our goals, but I'm terrible at grasping that until mid-semester. Would you guys give me some examples of how you would actually write in it in prep? And 100%, if you go on our website, and it might even be on our YouTube, but if you go to our website and scroll to where you can get the planner, which I put the link in the comments. But if you go there and you watch the video that I actually did a whole series of videos of how I would use this planner. But the number one thing that I want to tell you is it starts on day one, or I guess even if you're somebody like me who got a preview week where you get the syllabus early, it starts on that day where you got to go through, and we gave you the space in all of these so of course we have monthly spreads, we also have the weekly spreads, the weekly overview, and then the daily spreads. And in the weekly spot here is where you have all kinds of room to write. So future assignments, for instance, that's a great place to be like, here's what's coming down the line. And then I also, if I had something due on Friday, I'm going to already write it in. Hey, it's due today, right? So that when I'm working my way through the planner, all the due dates are in there and everything like that. Would this be good for incoming nursing students? Yes, absolutely.
Yeah. Oh my God. Because that's really the challenge of nursing school. And it's hard for a lot of people coming in because you are juggling so much. You have so many assignments. And if you don't come up with a plan and plan your time accordingly, then these deadlines and these assignments and tests can really sneak up on you, and you don't have sufficient time to prepare or to do your assignments. So I remember throughout nursing school, there were times where I had multiple tests and assignments all coming up like at the end of next week. And by having a plan and seeing that they're all falling on the same day, I knew I needed to work ahead and get some of these things done. So I would set goals to have this assignment done here, to have studying done, for this class here, really plan out my time so that I can stay on track and not get caught into this, oh my God, I have a million things due tomorrow, including a test, and now I need to stay up all night. Yeah, no.
And I also, in that video, I talked to you about this future assignments page or portion of the page, and I talk about how you can also use this in a way that makes more sense to you. Like if you know you have a paper coming up, you can use this spot to say, first I need to pick my topic, find my sources, write an outline, write a first draft, and you can plan that out here. So when it comes to our stuff, we designed it in a way that we think will benefit you. But if you think of a better way to use it, a way that makes more sense to you, I want you to do that. But there's a bunch of questions in here about next gen, and I just want to address this really quickly. Next gen NCLEX, nothing about what we are teaching you, what your school is teaching you. None of the facts are changing. They cannot change the testable nursing facts. So everything we make is going to help you prepare for next gen. And we are working on even more to help you with what next gen actually is, which is just a slight change to the way that some questions are asked to you. The old style questions are still going to be there. It's still going to be there. You're just going to have some new types of questions too.
But they are still going to be asking you questions based on the same body of nursing knowledge. And that knowledge, those key concepts, that is what we are teaching you, and we're helping you to really solidify so that you can be prepared to answer any type of question. It's all going to be based on those key points and that key body of knowledge. So really the foundation of nursing knowledge that you need to know to be successful on the NCLEX, that has not changed. It's just how some of the questions are going to be asked. So
some of the questions.
Right. Not all of the questions. So please don't panic. In addition to our resources, taking practice style exams is going to be a key part of how you prepare for the NCLEX.
Absolutely.
But I think you'll find that with our resources, we really help you focus in on what's most important to know, not only for your nursing school exams, but for the NCLEX. So you are going to be well prepared in terms of your knowledge for taking the NCLEX. And then if you pair our resources with a resource that provides some practice questions for you in the format of the NCLEX, and that's going to be really helpful for you.
Yes, absolutely. Also, totally forgot to say, Melissa, thank you for joining membership. That is so awesome. We're so happy to have you.
Welcome.
Welcome.
Glad to have you.
Somebody also asked about membership earlier, and I missed the comment. There were too many, but just there was a question about like what membership is and everything. And there's a whole video you can watch on the YouTube page if you want some more information. But essentially, membership it's similar to like any kind of thing where you get some extra perks, for being a member. So there's different levels, like there's different tiers of membership. The lowest level starts at $199, so it's and then it goes from there based on price. But every type of membership comes with benefits. We do live events for members only, which we'll be doing some more in August coming up. You get some early access to Cathy's skits from TikTok. Like there's a whole bunch of different things, and I don't have them all memorized off the top of my head. But the whole reason for membership is if you feel like you want to support us more, you like what we're doing here, we want to give back to you in that way too, and give you some stuff for being a member.
Totally. And so that includes today with the mild liner, but we are always looking to provide perks for our members. And we, as always, super appreciate the support, and it just helps to give us more energy. We super appreciate all our members. So thank you so much for joining, and for the people who are already members. That's awesome.
Yes.
All right. Let's see. I'll probably buy the planner that ends in January and then buy the calendar year version when it comes out. This way I'll be using the planner before I start classes in January. Good call.
Yeah, smart. And just like I was saying, there are planner videos that I have made from the first one that shows you what I think that this is how I would use this planner. This is what my best advice is. But more than anything, I want you to get it in your hands and see how you would want to use it, because that is how somebody said, I just discovered / accepted that I'm obsessed with planners, but I rarely ever use them. LOL. First of all, who are you talking to? Because that is my whole life story. But the reason you don't use a planner is because it wasn't made for you. And I found that for myself. If I was trying to make my life fit into somebody else's like world, like just a plain old planner from the store down the street or whatever, it never worked. And I didn't want to use it because I was constantly having to edit it and make it my own and buy those stupid stickers and customize it because I couldn't get it to be what I wanted. So I'm not saying that this is the perfect planner for every single nursing student, but I tried my hardest to think of stuff that you guys would need, and get feedback from the nurse team on this is what I wish I had. This is what I wish my students had. Because remember, we have like professors of nursing who work with us too. And so we wanted to make the best possible planner for you guys. So Loretta, you joined late, no worries. We have videos up right now on the difference in the planner, but this live will also be available it'll be posted and recorded and everything. And
Totally.
Tara, thank you for joining membership.
Totally. Do you think we should give, like, has it been enough time to give our next surprise out?
I think so. Okay, so if you missed it, you can right now get a completely free planner with the purchase of any advanced nursing suite or NCLEX pack using the code JUMPSTART. So that's scrolling there at the bottom. However, if you're like, Meris and Cathy, I love you guys, but I already have your stuff. I already have your flashcards. Like, I don't need any more flashcards. I got all of them. Okay, so if you are already familiar with that stuff, if you're already a part of the Level Up RN family and you are looking for a discount too, you can get the planner 35% off with the purchase of any other item on our site by using the code PLAN35. So I'm going to put that up here. I'll put it in the comments and everything like that too. But PLAN35 will get you 35% off the planner with the purchase of anything else on our website. So it's like an awesome deal.
Totally. Pharmacology cards, medical surgical nursing cards.
I don't know, like maybe you want our dosage calc book or something.
Oh,
like,
yeah.
You know, like this beautiful baby right here that we just launched. Maybe you're like, hey, I need the dosage calc book. Let me get a planner for 35% off.
Totally. But if you don't have our cards, that first deal with the Jumpstart, and I saw some people asking about the difference between the NCLEX pack and the advanced nursing suite. So the advanced nursing suite is basically like it's the NCLEX pack plus med terms, right? Medical terminology, as well as wound care. And I think so it's basically all of our flashcards and the the skills deck as well. So the NCLEX pack has a set of flashcards in it, which include like all of the core topics like fundamentals, med surg, peds, maternity, nutrition, psychiatric mental health, lab values, ABG. What am I missing? It's on the website, but if you look at it, you get like all of the core topics you need to be ready for the NCLEX. And then our advanced nursing suite adds in some of our extra flashcards so that you basically have everything. So that would be our wound care deck, as well as our medical terminology deck, and our skills deck as well. So
yes, and you can get our super awesome boxes too, yes. Which I'm obsessed with. So if you're like, I have all the flashcards, but I need boxes for them, well, you can get those on our website too, and get the planner for 35% off if you want to get these boxes, because I know I am a person who needs the box. Like oh my God, I can't just rubber band them together like some people can. I gotta have the box.
Right. And the awesome thing about the box, it's like magnetic. So it's just like one piece and you like flop it over and it closes up really nice. It's like super high quality. It's a really nice
it's like
box.
really satisfying too. I don't know if you're this way, but like when I close it and it gives the little like clicking noise, I'm like, yeah, like I love that little click. It's my favorite.
Totally. Okay, so everybody's got the codes. We got Jumpstart, that's for the NCLEX or the Advanced Nursing Suite, and you get the planner for free with the purchase.
Yep.
And then Plan 35 gives you 35% off the planner with a purchase of any other product on our website.
The planner and the flashcard deals that we're talking about right now are for everybody. You do not have to be a member to take advantage. The only members only perk right now is to get the free mild liner with your purchase. So that is for members only. It's not too late to join if you are wanting to get that. And you can get that and also one of these discounts too. But the planner and the flashcards are available on our website, leveluprn.com, for purchase. I'll drop the link in here again. This is where you can get the planner itself. So if you want to go check out what our site has to offer, we have flashcards, we have the dosage calc workbook, we've got the nursing school planner, we have the Nurse Squad study games, by the way.
Oh, yeah. Have you guys seen these?
Yeah, these are amazing. We're super excited about them. We just got a professor just emailed us today to let us know that at the end of her class, she's been using the Nurse Squad card game to ask her students questions to help them jog their memory on what's most important. So excited about these card games and excited for the next 4 that are coming up very soon.
And really, the flashcards and our Nurse Squad card game together really awesome because the flashcards will help you learn those key points, those key concepts you have to know. And then our game will make it, as a fun way to really test your knowledge and see how well you know those concepts while having fun with your friends. And there's different like nursing hazards, which are like real life type hazards that you would encounter as a nurse. And it just, there's like funny illustrations and the gameplay is super fun. It's a great way to kind of study and test your knowledge with your friends. Love Nurse Squad.
Yes. Raven asked how much the flashcard boxes are. I put it in the comments, but it's $10 per box if you want like just one, or you can get 4 of them for $32. And then Natasha asked, I bought the original entire first edition set of the flashcards. When I start back in the program, is it okay to still use them in addition to the new categories I have bought? Cathy, do you want to?
I would say yes. We are always improving and making our stuff better and better. But you should be able to follow along pretty well with videos. There may be some slight differences, but you should be fine with the original set. But we do, like, whenever we release a new edition, we have like incorporated new information, better information, maybe restructured some things, formatted some things a little differently to make learning a little easier. But for sure, if you have our previous flashcards, you should be fine.
Yeah, I would definitely encourage you though to pair it with the YouTube videos, because that's where you're going to see the improvements that we've made and the things that we've added to it or what have you.
Yep.
If I buy some things, can I save the third? No. So I'm so sorry. I should have clarified. All of these promos are through midnight tonight Pacific time only. Yes. So we will have other launches where we do other things, and I'm sure when we launch our calendar year planner, we'll do another fun live and all of that.
We'll do another live.
Yeah, but this is just for tonight. All of these, the Jumpstart code and Plan 35 expire tonight at midnight Pacific time.
Totally. So the difference, Moon Fairy is asking what's the difference between Farm and Farm Basics. So Farm Basics is really teaching you some underlying like pharmacokinetics, some basics as far as medication administration, and understanding kind of some underlying concepts in terms of pharmacology. The pharmacology flashcards is focused on medications. So it's just medications, all the key medications in each of the 10 body systems. So the Farm Basics is kind of like all of that foundational information that you need to understand about safe medication administration and pharmacokinetics in general. Yeah,
things like preparing injections, or here are some error-prone abbreviations to avoid. Here's about pharmacokinetics and absorption. There's all these kinds of different things. Here's about blood transfusions. It's more of the theory behind pharmacology. It's the like, here's your foundation. And then in our actual like pharmacology cards, that's where we have like anti-ulcer agents, histamine 2 receptor antagonists. You turn it over and okay, we're talking about ranitidine, famotidine. Here's the indications. Here's the side effects. Here's the patient teaching. That the pharmacology cards are just straight up the drugs you got to know.
Right. So if you feel like you have a good grasp on those pharmacology basics, that foundational information, then you just want to focus on drugs, you can just get the pharmacology flashcards. But if you're kind of new to pharmacology, then I would really recommend getting both the basics and the pharmacology.
Yeah.
And
absolutely.
The quizzes after the new videos are great. Yes. Yeah. So I know the only problem is that I made a bunch of videos. Well, we both did. Where we hadn't thought of the whole idea of doing quizzes at the end of the videos. And then I had the idea to do the quizzes and started doing them, and everybody loves them, but they're like, why aren't there quizzes on these other videos? And I'm like, well, I didn't have that bright idea until partway in.
Yeah, and you guys give us feedback on our videos, things like that. And then even things like once I started doing the quizzes, people brought up a great point, which is that I didn't say the answers out loud. They just appeared on the screen and people were like, well, I'm driving. I can't look at the screen. I'm listening to you talk.
Right.
Okay, cool. So now I say the answers. So we genuinely
we're always listening.
Yeah, we listen to your feedback, and it might be too late for us to make a change. Like we might still have videos in the can that are coming out, but I promise you we hear you, and we really do take it seriously.
Totally. I bought the flashcard. How is it used? So I'll tell you a few ways that I really like to use them. First of all, you got to kind of chunk it out. You got to like tackle one, a smaller set of the flashcards at a time. So I love to take the flashcards on a walk personally. So I will take a set of 20 flashcards and I will go for a walk and I will review those cards. I will, take a look at the front of the card, see what it is, what the prompts are for what is on the back. I'll flip it around. I'll review the information on the back, paying particular attention to any bold red text because those are going to be highly testable items. So you definitely want to know those things. And then I'm paying attention to any cool chicken hints and reading the information. Then I'm flipping it back over to the front, looking at the prompts again and seeing if I can recall what I just read and learned on the back of the card. And when I feel like I have most of the facts down, I go to my next card and I do the same thing. I flip it over, I read, I try to understand what's going on there, see if I turn it back around to the front, if I can recall that information. And if I can't recall as much, I turn it around again and review it. And I basically do that for each of the, 15, 20 cards that I take on my walk. And by the end of my, call it 45-minute, 50-minute walk, I have really learned a lot. Those 20 cards and just learning in bite-sized pieces, like with flashcards. So nursing school, the challenge of nursing school is the volume of information you have to know. There's like a million different facts and things you have to know. That is the challenge. So I have a previous degree in engineering, and I was like, I mistakenly told myself, I'm like, oh, how hard can nursing school be? I got through engineering school. Well, it turns out it's super hard, as you guys know. And part of the reason it's hard is because it's just so much information you have to know. And that's why repetition is key, and flashcards lend themselves well to repetition. Looking at those facts, being able to recall those facts and be able to go through them repeatedly. So that's one way I use the flashcards. Watching our videos while reviewing the flashcards is another great way to have that information sink in. Yes. So listening to Meris or myself kind of explain and provide examples for information and reading that on the card, you're kind of hitting all the learning modes, right? You're getting that auditory, visual, tactile learning, and it really helps the information to sink in. So,
and the back of our cards are matte too. So the front of the cards are shiny, but the back are matte, which was done on purpose so that you can write on them, so that you can say, well, my professor said I need to know this, and that's not on the card. So then you can add it, or you can watch our videos and say, oh, Meris just said this funny way of remembering it. That's not on the card. Let me add it. Let me write it down. Oh, Cathy just told me a story, and that's going to help me to remember. Let me write that down. So very much encourage you to get out your pen, get out your mild liners if you get a little level up mild liner and make your own notes on the cards too, because the act of being engaged in that way is going to help to cement those memories too.
I'm in a PN program. Will this be for me too? Oh yeah. Yes. There is huge overlap between PN programs and RN programs. And this planner and our products in general will absolutely be for you as well. The key thing for you to remember is just your scope of practice, which really depends on state, but just understanding what is inside and outside your scope of practice. But all of the really core information that's contained in our products is for you as well.
Oh, yes. And I work at the emergency room. I'm an ER trauma nurse, and I work with a bunch of people who are like working as techs in the ER who are in LPN programs right now. And I actually just ran into one of them. I was at the hospital for a meeting today, and I ran into one of them on my way out, and she said, Meris, I have been using Level Up stuff. Like, I'm so glad that I found out that you work for Level Up. I've been using it, and like, I feel so much more prepared tackling my NCLEX PN. Like, thank you so much. And she essentially said, there's some cards that I kind of set aside, and I know that those are for when I'm in RN school, things like the blood transfusions, the IV push meds, things like hydromorphone. She's like, I know that kind of stuff is not really going to be my big thing right now, but I kept it for when I go back to the RN program.
Let's see. Name tips to survive 5 weeks of OB besides the flashcards. I heard it's a hard class.
The videos.
Yeah. No, Meris has a complete, and she's like, she is like the maternity nursing master. Okay. Like in her, like your final, like maternity, didn't you like miss literally one question? Like
Yes.
completely. She took her ATI proctored exam for
Yeah, I
her
got a
final.
98%.
Correct.
Yeah.
98%. She knows her maternity like so well. And she's got a complete video series. So the flashcards videos, you cannot go wrong. She will help you get through that class.
Yep, absolutely.
Yeah, Raven said ER and trauma is their goal.
Yes,
That's
come
what she
join
does.
me. I'm board certified in ER and trauma. I love it so much. There is nothing else like it in the nursing world, in my opinion. I think that it is a rush every single day, and we get to make such an incredible difference in people's lives. So come join us. I'm so excited.
Anybody out there want to be wound care? That's my thing.
Martha says, I make notes on the cards, but I'll use friction erasable pen so I can erase it and give it to someone else. That's so smart. I love that idea.
Totally. I have never even heard of a friction.
Oh yeah, they're the best.
All right.
They're the best.
Okay, yeah, I didn't even know about that.
Michelle,
the stages
like
in the planner on my OB exam in school.
Do our job here, yeah, absolutely. So all of this stuff in the planner, the fetal station, the fetal positions, all of this stuff is intended to be the stuff that we think is the most commonly, like the stuff that you need to know and that you're going to be thinking of a lot. So that if I say, well, so the baby was ROP, what? Was ROP. Well, then you can look right here at this nice little diagram and see what ROP means. And even if you're like, I know that means right occiput posterior, but what does that mean again? Like, how is the baby positioned? You can look and see right here, ROP. That's what the baby looks like. That's where the head is in relation to the pelvis. So we have all of that on there for you guys. Yeah.
So Meris, do you want to go over what our, like the final, like big giveaway and what that is?
I do. So I'm super duper excited about this. Obviously, if you can't tell, I'm really passionate about the planner. I'm really passionate about helping people understand how to use it and how to learn how to manage your time and all of that kind of great stuff. And that is something that I know I can make a lot of videos on it, but that doesn't necessarily mean that I can answer your questions directly. But now I can, because we are going to give away a 1-hour session with me, and this is completely up to you. It can be you and me for 1 hour talking about the planner, doing whatever you want. It can be you and your nursing school best friends. It can be you and your whole cohort, your whole school if you want. I'll come on Zoom. It does not matter to me if it's one of you or your whole entire school. We will have an hour, and I can review with you how I would set up the planner. I can answer your questions. We can do give me your syllabus and I'll show you how I would put it in. You know, whatever you want to do, we can spend that hour talking about time management and how to be on top of that in school. This is not included, but I feel like we'll give you the planner too. Like I've made that executive decision now that if you get the one-on-one, you're also going to get a planner, because of course you are, because you need to have the planner for us to talk about it.
Totally.
So Angelina, I'm sorry, don't kill me.
Okay.
We are,
unless you already have the planner, you still like you can still win the hour with Meris to kind of figure out how to use your planner, plan out your time, get advice. She can provide a lot of guidance for you and a lot of really good information to help you. So
if you are still here, that's one of the things, you got to be here. And then if you are interested in this, because I know not all of you are going to be like raring to hang out with me for an hour and talk about planners, but if you are, just put the word planner in the comments here, and Angelina is going to be our magical sorting wizard, and she is going to put all of your names into a digital hat, and she will give me the name of the winner.
Yep. So yes. So if you're interested, put planner in there. And while we're waiting for people to be able to do that, someone was asking about mental health and do we have resources? Yes, we have a psychiatric mental health flashcard deck. We also have mental health information in the planner.
Yep.
And so we've pulled out some of the key information for mental health and put it in the planner. But in general, if you're not familiar, we do have a psychiatric mental health nursing flashcard deck, which is amazing. It is so amazing that we had a school, instead of requiring their students to get a textbook on psychiatric mental health nursing. They required them to get our Level Up RN psychiatric mental health nursing flashcards to help streamline their studying and get them the key core information they need to know. So yes, we have got you covered for mental health. So check out our flashcard deck and know that we do have some mental health reference information in the planner as well.
Yeah. And we really, mental health was one of the hardest classes for me in particular. All of the stuff about like the disorders and the blah, 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 like that was fine. But for me, it was the like the principles, the different types of therapies, like the therapeutic communication, like all of that kind of stuff. That was really tough for me. So it was important to us that we come up with good resources for you guys because it is tricky stuff.
You guys are legit angels for us students from Moon Fairy.
Aww.
I love it. Thank you. We are super happy to help. Okay, everybody got planner. Everybody who wants to win the hour with Meris and a planner, if you don't already have one, have you put planner in the comments?
Yep. I just asked Angelina to go ahead and get started.
Angelina's going to do her selection.
So, as soon as I get it, for those of you who are members who are going to be interested in getting the mild liner highlighter, just as an FYI, it's probably going to be about another hour or so before it posts. Angelina told me that it's uploading. It is just being slow. So if you don't see it right away, don't panic. It's going to be okay. It'll be up there shortly, I promise.
Totally. And yeah, so check out the member area in YouTube and you will see how you get to have the mild liner with your planner purchase.
Yes. We're giving away products to people not currently in school. Yeah, so we have, if you look at the scrolling right here, this is for anybody at all. So if you want to get the flashcards, NCLEX pack, or advanced nursing suite, you can also get a free planner using the code JUMPSTART, or you can save 35% on the planner with the purchase of anything else on our website by using the code PLAN35. So yes, that's for anybody.
Totally.
That's available for you. Yes. And should not have stayed away from your cards on mental health. Oh
no, you should use them because they're awesome. They're super awesome.
Okay, so Angelina just told me, and of course, hang on. All right, so our winner is Alessia, and so I see you here commenting. So if you are still here, go ahead and email support@leveluprn.com. Tell them your YouTube username, and they will get you set up in contact with me so that we can have our one-on-one. It is totally up to you if you want it to be you and me hanging out, if you want it to be me and your nursing school friends, your cohort, your whole school, whatever you want to do. I am happy to accommodate. So you just let me know, and we're flexible. I will find a time that works with you and your schedule. Thank you so much for being excited. That made my whole day.
Yay, congrats. You're going to have an amazing hour. Super, super lucky. That's awesome. Oh, okay. You just tried to get the advanced nursing suite and the Jumpstart code came back as inbound. Email us. So support@leveluprn.com and we will help you get that fixed.
Angelina did say, did you add the planner to your order? You need to have the planner in your cart also, along with the advanced nursing suite, and use code JUMPSTART. But if it still doesn't work, reach out to us, support@leveluprn.com.
How much is the cost to be a member per year? I mean,
it varies. We have membership is available as little as $199 a month, which, like if you're doing annually, it's going to be $24 a year. But we have different tiers. So you can see what the rewards are, what the benefits are, and make that decision for yourself. So it just depends, but it is all monthly. And you can just pay month to month and be a member for as long as you want.
Totally. So just as a reminder, the special promotion codes are only good through midnight tonight. So we've got Jumpstart. Again, that's getting you a free planner with an ANS or NCLEX pack. And then we have Plan 35 for 35% off the planner with any purchase from the site.
Yes, and I'm putting those in the comments here again. So
and
you can have them.
Just make sure I hit all the other comments here. Let's see. I thought I saw someone saying they wanted to go into wound care.
Somebody did.
Which,
It was Sarah. It was Sarah who won the dose calc book
oh,
last time. So that she wants to
yeah,
go into wound care and derm.
I love it. I love wound care so much. Yeah, so that's awesome. So I'm going to be doing some more wound care videos and in the near future. So definitely be on the lookout for that. And we have a wound care flashcard deck as well, which is the deck I wish I can give to every new grad out there, because unfortunately, they don't really teach you a lot about wound care in nursing school. And what they do teach you sometimes is not actually what's used in the real world, like sterile wet to dry dressings is not something we really do in the real world at the hospital. So I built that wound care deck to really get nurses the core information they need to know to perform wound care in the acute care setting, which is something you definitely have to do in the acute care setting.
And so speaking of wound care, I don't know if you guys know this, but a couple of months ago we did some free webinars, and one of them was that Cathy did on wound care. But in addition to that, we have a super exciting announcement to tell you, which is next Wednesday, same bat time, same bat channel. We're going to be doing a live event. And I guess it's actually not the same bat channel because it's going to be a Zoom situation. But the point is, I am going to be
different
doing
bat channel.
A different bat channel, same bat time though. I'm going to be doing a live event, and it's going to be a presentation on LGBTQ plus inclusive prenatal care. So if you are someone who works in maternity or outpatient OB-GYN, if you are somebody who works in any kind of setting where you might interact with patients who are pregnant, and you want to learn how to be a more inclusive care provider and be culturally competent and sensitive and aware, then I'm going to be doing that. But we also are going to be doing that as a contact hour. And if you don't know what that means, that is continuing education hours that are required for licensed practical nurses, registered nurses, anybody who has that kind of licensure. We're going to be able to give you contact hours for that towards the renewal of your licensure. So you've got to pay attention. You want to be on our email list. You want to be keeping an eye out on our social media, because we have so much more information coming for you about that, including I don't know, maybe a huge announcement or something. I mean, I don't know what I'm talking about, but yeah, there might be a huge major announcement coming. So if you are interested in that, please keep an eye out. Make sure you have joined our newsletter, our email newsletter, which you can do by just going to leveluprn.com, and you'll be the first to know more about our upcoming webinar. Oh
yeah, everybody can go. Students, everybody can go. So definitely join us. And Nicole, you are so sweet. You all go over everything I learned in LPN school, even things I didn't learn, in such a way that it clicks and sticks. I have the 2022 planner, all the flashcards, and the Nurse Squad set. I'm in love. We're in love. That's awesome. We are so happy. We are so happy to support you in your journey and help. We love helping nursing students get through nursing school. Truly. And to help you learn all the key things you need to know in a way that it clicks. That's why we do this. So to hear that feedback really makes us super happy.
Yes. And like Angelina said, please send us a picture of you and your stuff, or just your stuff, or whatever you want. Send us a picture, and then that way we can feature you in that sweet comment. That is so awesome. That made our day.
For sure. So thank you everyone for joining us. Be sure to use your discount codes by midnight tonight. And
if you are a member and you're looking for the mild liner, give it about another hour and then check the community tab. There will be a video there for you on how to get the mild liner. And one last question here. Is there an hourly timeline on the planner? There is not. We have it broken up monthly, and then we have a weekly spread. So we have the weekly spread here where you can do your assignments, tests, and quizzes, like things on your own to-do list, lab simulation, clinical schedule, future assignments, study tracker, and habit tracking. And then the daily page we have set up here so that you can put anything that's important to you, any sort of meetings or deadlines or whatever you want there. But we also have our non-negotiables. So the non-negotiables are the system that I started using when I was in nursing school, where I said, what are the 3 things I have to do today to call today a success? And every single day that's a little bit different. Sometimes it's like feeding the kids and taking a bath and drinking some food. And sometimes it's like writing a paper and taking a test and those sorts of things. So we gave you that space to plan, but we did not have room for an hourly, or else this thing would be like 3 times the thickness.
Totally. Plenty of room though to get your life in order and kind of plan out your time, both in nursing school and outside of nursing school as well.
Absolutely. And
I
am in the state of Ohio. I am an Ohio nurse, so not Florida. I would be dying if I were, because I melt very easily in the heat.
I need to get her out to California, which is where I'm from.
I know.
So I keep trying.
I can feel the tug.
I know, right? All right, guys. Definitely check out our website. I know that there's some latecomers asking about like med surge tips and exam preps, prep advice. Come to our website, leveluprn.com.
Yep.
We have flashcards for all of the core areas in nursing, and we have hundreds of free videos on YouTube. So we're here for you. And definitely sign up for our newsletter.
Go to the resources tab. This is, I think, one of the best kept secrets. I don't know why most people don't know about this. If you go to leveluprn.com, at the top there where it says like nursing flashcards, games and tools, whatever, go to the resources tab and click on whatever it is that you are looking for help with. If it's med surge, if it is fundamentals, whatever, it doesn't matter. We have blog posts on there. We have different videos we've done for things that we think are going to be helpful to you. We've got searchable indexes for our some of our flashcards deck, so you can see exactly what card it is that we talk about, asthma or whatever. So there's a whole lot on there. Get on that website, poke around, you're going to find some cool stuff.
Tons of stuff. So thank you everyone for joining us tonight. It's always fun to do these live events and to get to chat with you guys. Super appreciate the support and love. And for those of you who have the planner, hope you love it. Those of you who are getting the planner, I know you'll love it. And if you have any questions or issues with like the discount codes, definitely reach out to support@leveluprn.com.
And when you get your planners, please take a bunch of pictures. Show me how you set it up. Show me how you customize it. I want to see your cute doodles in the margins and all of that stuff. I want to see all of it. It makes me so happy. And the nurse team individually, we see every single review you send in, every comment, every feedback suggestion. We see it all. And it makes me so happy to see you enjoying the planner. So please, please, please send those pictures in. I love it so much.
All right, and we'll see you guys, for whoever's interested. We'll see you guys for the live next Wednesday.
Yep.
All right.
Bye,
Take care,
friends.
everyone.